Hey, this is Dr. Tapia. Let's talk about mask mandate. I have tried to be very consistent in my videos in that they are informative and educational. From the very beginning, I believe that mask made a difference, as I mentioned in my first video over a year ago. Since then, I have continued to encourage the use of masks. For my friends, I've encouraged the use of KN95. If not everyone's wearing a mask, then it's the only mask that's going to protect you. At that time, if everyone wore a mask, I believe that any kind of mask, whether it's a surgical mask or a cloth mask, was adequate. As the Delta variant came around, I continue to encourage use of KN95, but if you don't have access to KN95, I recommend the use of a cloth mask over a surgical mask, which provides a better protection. Throughout this whole pandemic, I've been a strong advocate of masks. I've attached a link in the description that supports the fact that masks work. One is from Nature Communication. The Nature Communication says that reduction in total deaths and infections increased with mask effectiveness and availability, and that even the delayed implementation of a general mask wearing policy could still provide reduction in total infections. They also found out that surgical masks were assumed to be 3 times more effective than face coverings, both in terms of protection and containment. Which brings us to the topic of mask mandate. Last week, Mayor Quinn Lucas and Jackson County Executive Frank White executed a mask mandate for Kansas City and Jackson County, Missouri, respectively, to be effective on Monday, August 9th. I, as a healthcare professional, strongly support that mask mandate. If you look at the consequences, if you don't apply any kind of mitigation effort, there are examples throughout the country of how bad it can get. I saw a report the other day that the Arkansas governor reported there were only 8 ICU beds available in all of the state of Arkansas. I saw a report yesterday that the city of Austin, Texas is down to 2 ICU beds for their COVID patients. And I also saw a report last evening the Florida Hospital Association is receiving several hundred ventilators from the federal government because they are at 90% capacity in ICU and they expect to be overwhelmed within the next week. These are the consequences when you don't act against COVID. Bates County and Cass County are red zones when it comes to the spread of the infection. I have patients that are diverted on a daily basis to a different hospital because the emergency rooms in Kansas City are full. The reason the ICU beds are important is because if there is a trauma, a car wreck, a heart attack, a stroke, you want to get into the emergency room as soon as possible. Any delay in that transportation can mean the difference between life and death. So if your nearest hospital is 5 minutes away, but now you're suddenly diverted to another hospital 15 minutes away, that 10 minutes can cost someone's life. So you understand, what is the big deal about the ICU beds? That is the big deal. The city becomes in crisis mode. The city goes into crisis mode once you are out of ICU beds. The emergency room ties in with ICU beds because the emergency room stabilizes the patient. But once that patient is stabilized, then they need a bed to put that patient in. Without an ICU bed, that emergency room cannot be open to take that patient. And so there is significant effect in terms of the number of ICU beds available per hospital. The problem with that is when a person goes in ICU, especially with COVID or even in trauma or heart attacks, rarely do they come out of the ICU the next day. You're looking at a patient that goes in ICU, and on the average, they may spend 4 to 5 days there. So you're not talking about, I'm going in one day, out next. You're filling up 3 ICU beds in a day. You're eventually going to reach capacity because you're not going to be able to send people home. And as a medical professional, I've seen the outcomes when it comes people suffering from COVID. My friends who work in the field, in the field, feel overwhelmed. I had a nurse tell me the other day, I don't know if I can do this anymore. After going through COVID last year and again this year. I had a friend tell me that we're not ready. We can't handle this. I've had some good, excellent nurses retire from nursing altogether and go to other fields because of what happened last year. My concern is if we go through it again in our community, we're gonna lose more excellent nurses. And we're gonna lose some important people due to deaths. This is not a political statement. I have nothing to gain. I'm not running for office. I'm sitting here as a doctor, sharing with you what knowledge I have, what information I've gained, and what experience I've encountered. There is nothing to be gained by eliminating the mask mandate, but we have a lot more to lose if we do. I do this because I want to inform you so you could protect yourselves, so you could protect your family, which in turn supports our community, which in turn benefits our hospitals and our health and our nursing homes and our healthcare systems. It's a little drop in the water that creates a ripple effect. Protect yourselves and your loved ones.